Hello, I'm Nellie Gonzalez, and I just want to thank our CBC Facebook viewers for joining us right now for this very important panel discussion about how the community can do more to support the transgender community, especially those that are transitioning later in life. So we are taking your questions right now. If you want to ask a question to one of our panelists, please post it on our CBC Manitoba Facebook page right now. So I'm going to start by introducing our panel here. This is Rhea Mossman Sims. She is a nurse practitioner at Klinic Community Health in Winnipeg. Klinic provides specialized healthcare services to transgender and gender diverse people in Manitoba through its transgender health clinic. Hi, Rhea. Hi. And this is Ellie. Now, Ellie Caslake is a coordinator for the older adult program at the Rainbow Resource Center. And basically, it's a program for older adults in the transgender community who need a safe space to get together and to talk.
Yes.
And Ellie, I'm going to start by asking the first question.
Okay.
Because as you know, we posted a story today about a woman named Lynn Frost, who's 63 years old. And she's transitioning and to a point where she is having breast augmentation surgery so late in life.
Yeah.
But your story is unique as well. Your story is interesting. How similar is your story to Lynn's?
I certainly came out after my 60s. I was 68 last year around this time. And I finally came out to my children, who are in their early 40s, this past September.
Right. How difficult, though, was that?
I was more scared of their possible negative response than I've been about anything else in my life. I'd heard so many stories of other transgender women who had come out to their family and lost everybody and everything. And my son's response was, I figured as much. What? When? He said, about 4 years ago. Why didn't you say anything? I was waiting for you to say something. My daughter's response was, why were you afraid? Because you and Mom brought us up.
Yeah.
I am so fortunate because so many other trans male and females don't have that kind of response from family and friends.
Yes, and in Lynn's case, she says her family pretty much disowned her when she told her family that she is a woman. She identifies as a woman now. And that's what I wanted to talk, Rhea, if you could just sort of talk about, I mean, going through breast augmentation surgery so late in life, and I mean, what kind of support is there for women like Lynn Frost? Like, how complicated is this procedure to go through the process? Like, where do they go, first of all?
Yeah. Well, certainly I can speak to a lot of that in regards to the services that are available for people age 17 and up. So they come and see us at Klinic, in the Trans Health Clinic. Our intake times are about 2 months. People can self-refer, or they can have a referral by their healthcare provider as well. So and from there, the process is that they see a social worker for the first visit, and then for the second visit, they'll see an intake visit with a nurse, and they'll see an intake visit with myself, or another physician that works as well on the days that I don't work. And then we talk to them about their transition needs, because everyone's needs is very individual, and so we need to talk about that first as well. For certain gender affirming surgeries, such as top surgery, there is a process that needs to be gone through where they need a mental health assessment at this point in time. Perhaps that will change. They need a mental health assessment for those surgeries first, and then once that mental health assessment is complete, there will be a letter submitted to Manitoba Health for coverage for these surgeries, but it's actually sort of a process where the client is actually referred to a surgeon first, and then the surgeon will submit a funding request to Manitoba Health. So.
And the mental assessment, the mental health assessment, that's just to make sure that people are really sure that they want to go through with this, because it is such a life-changing surgery.
It is, but let's not forget that there are a lot of life-changing surgeries that are not necessarily gender-affirming surgeries, and so I guess the thing is that we don't always do a full mental health assessment on people for that. So sometimes we question whether or not it's really how important it is to do a full mental health assessment on someone in that regard. I think it comes down to ensuring that people understand the permanence of the type of procedure, and that they're well aware of the possible consequences should they change their mind, which,
Which can happen, I guess.
It can.
So far, we've been getting some positive responses to the story and to this panel discussion. I should mention Krista Smith Gilman. She says, she posted here on Facebook not too long ago, having a transgender son, I am so happy to see the positive press. It's going to take educating people and having support in place to help all our transgender and gender non-conforming people live their true and genuine lives. Now, this is interesting too because she is a parent of a transgender son. Let's talk about that. What kind of supports are out there for relatives or loved ones of someone who is transgender? I mean, do they need support as well? I mean,
absolutely, and it's there.
They do, eh?
At Rainbow Resource Center, we have a group called Parents, Friends, and Family of Trans Individuals. Okay. They meet every month. Folks can get the contact information by going to the Rainbow Resource Center website. And it's a fantastic support group. I've met some of the parents that are involved in that, and some of their children are not in that under 18 age. There's a few that are in their 20s and 30s. And yeah, it's a place where people, parents, friends, family can connect, share challenges, share successes. Absolutely.
And what about for parents that might not be as supportive? Is that common? Do you see that?
Well, certainly in Lynn's story, it was there.
Lynn's story.
I heard so many negative stories about parental response over the years. I think if my parents were alive today, they would be very supportive. But as I said before, I was very lucky through my whole life with this. I'm sure it is very difficult to have a dream, an expectation of your child, and then all of a sudden there's a complete changeover of who that person is. Some parents might not see that coming.
Rhea, do you want to add to this?
Actually, I just want to give a big shout out to Krista, that it's really fantastic, and that her child is very fortunate to have a supportive parent as she is, first of all. And secondly, I think that parents, really, I think it's just a big education piece that, people need to understand. But also, I think that, personalities are often associated with gender. And that parents sometimes probably forget that the child they have is still the same person. They're just a different gender, and that doesn't necessarily mean that everything changes. But I think it's the grieving over the gender, because it's such an emphasis at birth, for example, that's what,
blue, pink, male, female.
As soon as the child is born, it's a boy, it's a girl, it's just, it's so common to have that assigned gender at birth. But if we can, maybe went along with the idea that it's an assigned gender at birth, and that's okay, maybe more parents might be able to.
And somebody else, there's been a couple of comments on our Facebook page too about the mental health evaluation, which we sort of talked about in the beginning. What does that involve exactly? What kind of questions do they ask? Yeah,
absolutely. So we have an in-house psychologist who performs the mental health assessments, and as well, I'm a mental health provider, so I'm qualified to do them. I haven't done them yet because I'm seeing a lot of other people for follow-up and for hormone initiation and all those visits, so I haven't had the time in my schedule yet. But basically, we're there to just ensure that they understand the permanence, actually, of the surgery, and we're there to provide them with other mental health supports should they require them. Really, it's about a 1 to 2 hour assessment, because there's a very good questionnaire that's just confirming that, if there are any other mental health concerns, that we look into that. And we want to, of course, ensure that people have mental health stability for surgery as well. So that means, being able to look after their post-operative care, and that's more important to us.
And how long is the process from the time that you go in to get the mental health assessment to actually getting approved the funding for the surgery? It can take a while, right?
It depends. It actually depends on the surgery too. So for basically we are waiting for the mental health report to come back. So once that's come back, then one of us practitioners will be notified to send a referral. And so then we send a referral to the appropriate surgeon. So if it's in Manitoba, it really just depends on when the surgeon sees the client, because they'll submit to Manitoba Health for that funding. And that can be within about a month to a matter of weeks, actually, for Manitoba Health funding to be approved. Even for surgeries out of province, so those funding requests are already sent automatically, even along with the surgery request to the surgeon. Manitoba Health tends to approve most of those funding requests within about 3 to 4 weeks. They've been pretty good in terms of their turnaround time. So it's really not about the Manitoba Health approval so much as sometimes just the surgeon wait times.
And not all the surgeries are done out of Manitoba, like you said.
That's
they're
right.
done in Montreal. So which are the surgeries that are done in Manitoba?
So gender affirming surgeries that are done in Manitoba would be considered the top surgeries. So breast augmentation or bilateral mastectomy, chest masculinization surgeries, as well as sex organ removal surgeries. So orchiectomy, which is removal of the testicles, or hysterectomy, which is removal of the uterus and possibly also of the ovaries.
With respect to older people like Lynn, like yourself, I mean, is there a risk involved? What is the risk?
Absolutely. I think it depends on, it's by an individual basis.
Yeah.
It's based on what other health concerns there might be. You know, so if there are any comorbid conditions, like for example, potentially diabetes, obesity may affect the potential for surgeries to wait until people are at a better health status before they can receive those surgeries. But I don't think it's based on age specifically, not that I've been aware of.
Yeah, and Ellie, this is a personal question, but is this something that you would consider as well, surgery in the future?
I keep asking myself, for what purpose?
Yeah.
My partner and I have talked about this at length. Pam and I have been together for almost a year now, and we're very open with each other. And I don't know why I would. I just don't. It may come up, but it hasn't right now. But I'd like to ask a question too regarding mental health. Being transgender is not a mental health problem. It is not a disorder. It's the fallout of all of the stresses that transgender people live with that creates issues with our mental health.
Yeah, I would concur with that quite a bit. Absolutely, anxiety because of a fear of being misgendered, or even fear for safety. Right?
Yes. Oh yeah.
There are comments coming in though about society not really accepting transgender people, and it's still happening today. I mean, it is getting better.
Yeah, I'm laughing at myself.
I mean, I've been hearing both sides, that it is getting better, but I'm also hearing we have a long way to go. Alistair Ramsey Mackenzie, I apologize if I'm not pronouncing this right, says, I'm finding in rural Saskatchewan I can't even wear a skirt being born male without being judged. I'm disappointed that if women can wear trousers, that I can't wear a dress or a skirt. Also, healthcare is atrocious. I've seen transphobic doctors, experienced months of wait lists, doctors getting, quote, sick, etc. Very frustrating. Of course, this is rural Saskatchewan. I don't know what the situation is in Manitoba. Have you been hearing, Rhea, anecdotally, just sort of what people are saying about the service?
I'd like to think things are getting better rurally. I think that we're starting to have more new physicians that are a little bit more open-minded, and also it is starting to become part of the medical curriculum. I can't speak specifically to that because I'm not a physician, and I'm hoping that it is also part of the nursing and nurse practitioner curriculum. I don't know how much of it is though. Like, I think there might be a a class perhaps, but I'm not sure if there's a lot of information on the rainbow community in general. So that is something that we look at working towards, you know, and it's really about people being able to find the time to change things, right?
And Ellie, you were nodding your head when I was reading the comment about the judgment.
Yes.
Yeah.
Why?
Personal experience. Last November, I went to a very, very large organization right here in Winnipeg and needed help finding where I was going. And I went to the security desk, and there was, for all intents and purposes, a male, late 50s, sitting behind the desk. And I don't know, I thought I looked all right. And he said, "Yes, sir, can I help you?" And I said, "Excuse me, sir, like, do you have any idea how much work goes into being me? Please don't do that." And he says, "I'm very sorry, sir, I won't do that again." Then a young security person came out and said, "Ma'am, can I help you?" And he took me to where I was going. I'd like to add something for the last question, the individual from Saskatchewan. There is an organization called Out Saskatoon. Might possibly be services, resources, folks for that individual to contact.
Yeah, but do you want to just tell the community just sort of how it feels when you're called sir, even though, you know, you are clearly a she.
Oh,
and,
thank you.
And you look great, and I'm just wondering how that makes you feel. I mean, what's the message you want to get out to people that may see you out in public?
Just try, hello, can I help you? If you're not sure. And even if you think you're sure, just say, hello, can I help you? And then when I introduce myself as Ellie, try just saying, Ellie and Rhea were talking, and Ellie said, and Rhea said, as opposed to trying to get caught up in he, she, Mr. Man.
Yeah, and I should mention, you know, both Rhea and Ellie identify as she, the pronoun she. But let's talk about pronouns, because I think a lot of people get caught up in that. Maybe talk about that. What is some advice that you can give people, you know, when they see someone on the street, and how we should address them, you know?
Well, I think Ellie really put it out there right away, is that don't assume pronouns, and that people don't have a preferred pronoun. It's a correct pronoun. That the pronouns aren't necessarily, they are not preferred. They are who we are. And I guess I'd also just speak to that a little bit in that if people want to look at further resources, there's a really good web page called They Is My Pronoun by Dr. Lee Ayrton, and they are a professor of education at Queen's University, and I believe they also have a very good book out right now called Gender Your Guide, and there's some other underlining subtitle to that, but it's a very good book for those of us who are cis and heteronormative and have been in the world as like sort of a binary sort of world where it's he or she and there's nothing in between, to try and understand and get our heads around things, because we'd like to do things right.
Yeah, we are getting comments about that. AJ Bud says on Facebook here, using gender neutral language among strangers, people you don't know, is really helpful. So I guess maybe what you were saying, not to assume, you know, that someone is she or he, and that's sort of what you wanted to get across.
And I have to say, it's still a learning process. There are many times that I probably have misgendered or misspoke, and so I'm really trying to learn how to be more gender neutral, even when it comes to children. Addressing my kid instead of my son, my daughter. That might be important, you know, in terms of using more gender neutral terms, or because we can't assume.
So it's okay if someone out there feels confused or maybe don't know what to say.
Absolutely.
Absolutely.
It's normal to feel that way.
We have older adults coffee and chat at Rainbow Resource Center every Thursday from 10 a.m. till noon. Here's my plug. A dear friend, John, every once in a while, did it again last Thursday, referred to me as Ellie and then said he, and then stopped himself and came over and gave me a big hug. Sorry. It's okay.
It's okay. And especially for someone that, this is why I was talking about the supports for families, because a lot of people that may know you as he your whole life.
Oh, yeah.
And then all of a sudden, now at 68, no, she.
Yeah.
And it can be hard for some people to remember, I guess.
I had a meeting yesterday afternoon with a professional colleague. Her name is Kathy, and we were talking about this, and she knew me for 10 years.
Yeah.
Yeah.
And then to go,
Yeah.
so it can be hard.
Yeah, yeah, of course. And I think we're all very understanding. We have to be. You know, people are really like everybody who's calling in this, and you folks. You're being extremely supportive, so interested in who we really are, and we need to appreciate that and understand that. Okay, you know, so maybe you're going to call me he by accident. Oh my God, that's not the worst thing I've been called.
Yeah. And why is it, so this is my question, why is it so hard for some people like Lynn and yourself to come out late in life? Like, why does it take so long for some people? Because we hear about stories, people at age 12, you know, they know, or age 10, and then other people, it takes them so long to finally just admit that they are not who they are.
I knew when I was as young as I was, when I became self-aware, and my parents thought I was gay, and they worried about that because nobody knew what transgender was. I didn't come out for so many years because I was afraid of the repercussions. I was afraid of, as I said, losing friends and family, afraid of losing my job, and I did. A very well-paying job that I loved to do right here in Winnipeg because I was transgender. There has been a time when our whole LGBTQ community, all the alphabet, it was illegal just to be who we are. And we were afraid of coming out of that closet.
So fear.
That fear stays with us. Sure. You know, all of a sudden it doesn't go away because I'm starting to present to myself who I am. I'm still afraid, and I know Lynn was, and she's such a brave person to do this at our age.
What kind of advice can you give family members and loved ones? You know, what kind of advice can you give them? Because this is a reality for a lot of people. What would you like to say? What kind of advice would you give them?
If I say I love someone, am I loving the person who they are, or am I loving this physical image that's in front of me? If all of a sudden I became blind, would I stop loving that person because I can't see them anymore? Boy, just accept the fact that we haven't changed. We are the same person inside, and we're part of our parents and our siblings and our friends, and we've grown up with all of that, and yet we are this person. So just accept that, because we love you.
Rhea, do you want to add to that?
As a parent, there are times when I've actually said to the children, I love who you are. And that actually comes from, it is a quote actually from Jonathan Livingston Seagull, if you've ever read that book. It really, at the time that I read it, which was very young, it had such meaning for me to think of loving someone for who they are. You know, and so that's where I would leave that.
Yeah, Kimberly Donwee just wrote on there, no judgment, everyone is perfect. How does that make you feel?
I have known a few people that are more perfect than others. That's an old joke. You know, I actually agree with that, because even the little faults that each one of us have still goes to make up who we are and how we relate to other people. Yeah, I'm more a spiritual person than a religious person, but this isn't a choice that we made. I didn't all of a sudden when I was 19 years old think, geez, you know, I'm not going to play hockey anymore. I think I'm going to be a woman. It doesn't work like that.
And
It's
who
not-
says women can't play hockey?
well,
plug in
yeah,
there for-
Don Cherry, I think.
Yeah.
Hi, Don.
Yeah, but you know,
But
that's
you're
a
saying
whole other story with
it's
the
not a
hockey.
decision. It's not a decision
No.
you make.
No.
It's just discovering it, I guess.
Yeah, and some of us discover who we are later in life or early in life. And while we're talking about that, the term, and thank you, is transgender. It's not transgendered.
Yep.
This isn't anything that was done to anyone.
Yeah.
It's who we are. We've always been this way.
And tell us about so you run a program at Rainbow Resource Center, as you mentioned earlier, for 55 and up?
Yes.
Okay.
Older Adults Resource Space. The group is called Over the Rainbow. 55 and older, lesbian, gay, bi, trans, two spirits, and there's a plus and asterisk. We don't want to leave anybody out. And we have a real mix of people that come. 126 members, anywhere from a dozen to 20 people sometimes for coffee on Thursdays. Take a roll of the dice and that'll give you the stats as to how many L's and G's and B's and T's might be in the room at any one time.
Yeah. And it's a place where they can go and just feel free to be who they are.
Yes.
And get support. Yeah.
And I've got a little short story to tell you about that. Have we got another 30 seconds on
we
this?
do have a little bit of time, yes.
Okay. 3 weeks ago, an individual came to Resource Center in the morning, clearly identifying as male, said that they had heard about this coffee program. Could they come and join? Came to coffee, started to feel so welcome in that group of about 16, 18 people that day that after 10 minutes, this male individual called me over and said, Ellie, can I say something to the group? And I said, sure, you know, so. Quiet everybody for a second. He would like to say something. And the individual stood up and he said, actually, my name is Wendy, and please call me she.
Aww.
What? 10 minutes?
Yeah.
That's a positive space where everybody can just be themselves. That's, wow.
Yeah, because they weren't afraid. They just
weren't
felt that comfortable.
Yes, yeah.
And before we go, Rhea, could you just sort of talk about where people can go? We understand that the Klinic has a special transgender health clinic.
Yes.
So is there like a number that they can call to?
Yes,
Or should
yes.
they go to a website? Where can people?
Well, they can self-refer at a phone number at 204-784-4051. But if they go on our Klinic website, klinic.mb.ca, and they look under health services, they'll find transgender health, and they can click onto that, and we have spots for community members as well as for providers, so that we can encourage providers to have more capacity to prescribing hormones and providing general health care. So, and yeah, it's about a 2-month wait for clients who go through our intake program.
Okay. Well, thank you, both of you, for joining me for this discussion.
Thank
It's
you.
a very important one. Thank you. And thank you to our viewers, too, for sending in those questions and comments. We appreciate
Thank
it.
you.
Great, thanks for having us.